We just recently celebrated the 20th anniversary of the founding of Beacon Hill Village in Boston, which really marked the beginning of a whole new approach to dealing with the growing challenges of aging in place. I'd like to spend the next few minutes talking about the village concept and why it's important. But first, I'd like to provide a little bit of historical context. Why are we so concerned about this phenomenon of aging in place? Well, these two charts illustrate the dramatic demographic shifts that the United States is going through. We're about 2/3 of the way through that demographic shift, which occurs very slowly over a period of decades and even generations. But you can see the dramatically different profile of the population represented by these 5-year age cohorts, the dramatically different profile between 1960 and where we're headed in 2060. The most obvious change is that, whereas in the past, relatively few people really survived into old age. And so the older generation was a relatively small part of the population. What we see coming, and we're already well on our way towards this, is a much more even distribution between generations, with a lot higher proportion of the population being over the age of 60 and over the age of 75 or 80. Now that's, in a way, that's all good news. It means we're living longer, we're having fewer children. So one of the interesting things about this chart is that even though the chart on the right represents a population of well over twice as big as the chart on the left, the number of children in each population is almost identical. So the real shift has been this shift towards an aging population. Another way of looking at that is that when Social Security first started, the dependency ratio of active workers to retirees receiving benefits was about 8-to-1. Today, that's about 3-to-1, so 3 active workers for every recipient of benefits, and we're headed towards closer to 2.5-to-1. Another sort of milestone that we're approaching pretty rapidly is that by 2034, for the first time in our history, there will be more seniors over 65 than children. So that represents a major shift. Again, the older population used to be around 8% of the total. Today it's around 18% and headed towards around 22%. And another interesting figure which leads into this whole aging in place phenomenon is that 2/3 of the house, that 30% of the households are currently headed by a senior. So essentially, what this means is that we've kind of added a third phase of life. We used to think of things as being childhood or adulthood. When we look at this profile, in addition to childhood and adulthood, we've essentially added a whole third phase, which one prominent author has termed elderhood, meaning that we all have to be prepared for living much longer lives. So one obvious question out of this is, where are all these seniors going to live? If you ask them, the answer is pretty simple. 80 to 90% of those seniors would like to continue living in their own homes. And most of them see that as a simple continuation of the path that they're currently on. But, if you look 10 or 20 years in the future, rather than 10 or 20 years in the past, that path isn't so simple. It's not just a continuation of the path you're on. It's a new path that you're facing as you approach this phase of elderhood. The National Aging in Place Council has identified 5 broad areas of growing concern as we become older. And really, just a few quick facts about these various areas of concern. So housing is obviously one. Even though 90% say they would like to continue living in their own home, government figures show that only 10% of those homes of elders are suitable for elderly living. So things like bedroom, bathroom, kitchen on the same floor, no steps in the entryway, easy access to different parts of the house. Health and wellness, again, government statistics show that 90% of elders deal with some sort of chronic health condition, not necessarily disabling or seriously limiting, but things that require attention, things that require care, medicines, regular doctor's care. These are things that we all, as we age, live with. Personal finance. Only half of the US older population has virtually no retirement savings set aside, other than pensions and Social Security. Transportation is a big issue as we get older, and then social engagement. There have been numerous studies that show that social isolation is a major health factor. That one study I've seen shows that social isolation is the health equivalent of smoking 16 cigarettes a day. So we really need to deal with these kinds of issues. And the real bottom line of this is that at some point, aging in place needs to become a conscious strategy, something we think about, something we plan for, something we have to deal with. So that's where the village concept came in, and it offers a path forward for this issue of where are all these people going to live and how are they going to live. Most of us are familiar with the age segregated retirement communities that may work very well for some people. They do definitely address, specifically designed to address many of those previous concerns that we just talked about. So they're going to be a solution for some people, but they're not what most people want. And the magnitude of the demographic shift requires some new ways of thinking about the problem. So most people say that they want to continue to live in their own homes. And it's not clear that these age segregated retirement communities can scale up to anything like the magnitude of the demographic shift that we're currently experiencing. So what we need to deal with this aging in place phenomenon is we need some solutions that are, first of all, cost effective, that are sustainable over time, so not temporary solutions, but something that has a lasting effect, and that are scalable across the entire country and the entire demographic shift that we're experiencing. So that's where the Beacon Hill Village really comes into play. It started 20 years ago in a neighborhood in Boston, and they came up with what was really at the time a revolutionary approach to how to deal with the phenomenon of aging in place in your own home. And they called it a village. So what is a village? Well, villages are, they're basically neighbors helping neighbors, but not as a business, also not as just an informal group of friends working together, but rather as a formal organization, which they termed a village. And these villages, this village in Beacon Hill and the ones that have formed since then, they're community-based, they're nonprofit grassroots organizations, and their whole focus is on helping older adults age in place while staying connected to their communities, to their multi-generational neighborhoods that they've lived in most of their lives. So how does this address the three criteria that we were just talking about? So first of all, cost effective. This approach is very cost effective because it uses existing housing. It doesn't require building whole new facilities with all new homes to deal with the problems of aging in place. It leverages volunteer resources for many of the activities, so also very cost effective in that regard. And it, to start a village, it doesn't require building new facilities. It can leverage off of the existing facilities in the community. It's sustainable in that it has a formal structure. It has a legal status as a nonprofit organization, and it's rooted in the local community. So it's meant to be lasting. It's not just a temporary thing of a group of friends getting together and helping each other out. And finally, as we'll see, it is a scalable solution. These villages can be replicated in local communities throughout the country. They can take a lot of different forms. Some of them are quite small, just a few dozen people. Others have hundreds of members. Some are based almost entirely on volunteer resources, while others have professional staff to help provide the services. Some of them have no dedicated facilities at all and use things like local schools or community rooms, whereas other villages do have facilities that they can use. So anyhow, there are a lot of different ways that this can be scaled up to address needs of different communities. This seed, this village seed was planted, and it started slowly, but over the years, it has gained a lot of momentum. Right now, what we see nationwide is there are over 300 of these villages serving over 40,000 members in the various communities. You can see some major concentrations in the New England area, in the Washington, D.C. area, and Northern California. Northern California is the third largest cluster of these villages around the country. And you see that there's a kind of a predominant coastal density to this, but they are spread throughout the United States. If we look at California specifically, there are over 44 villages in California, and more than 20 in the Bay Area, depending on how you define the Bay Area. Here we see the Bay Area represented. And one of the interesting things here is that this is Avanitas Village. And most of the villages in the Bay Area, these 20 plus, most of them are concentrated in the North Bay, the East Bay, and the Upper Peninsula, the Northern Peninsula. Avanitas Village is really the only village between the Mid-Peninsula all the way down through San Jose. So, there are opportunities for additional villages down here, but right now, Avanitas Village is the only one. And Avanitas Village was a pioneer in the village concept. It was the 5th village in the country. It was the first one in the Western United States. And it does have an organizational umbrella that it works within. It operates as a semi-autonomous program under the organizational umbrella of the Avanitas Senior Center. That means, we have a separate budget based on membership dues and donations. We have a professional staff of 2.5 people to help provide some of the services that we organize for our members. And we have about 330 plus members in Avanitas Village. The other thing about Avanitas Village is it does have full access to the Avanitas facility and to all the programs offered by Avanitas, and it serves the Mid-Peninsula area. So this is the facility that we have access to in downtown Palo Alto. And basically, that's what Avanitas Village is all about. These are some additional resources that you can look at if you want to get some more information about these things. So the National Aging in Place Council that I mentioned earlier. There is a national organization of these villages, these 300 plus villages, a website, an annual conference, and various ways of sharing information and experiences. There's also a California organization for the villages that are based in California. And then finally, this is the website for Avanitas Village. If you want to get any additional information about Avanitas Village, you can go to this place and find out more. There's a public website there, and you can find out a lot more information about Avanitas there. So I hope you'll take advantage of some of those resources and learn a little bit more about the village concept and how it might be useful to you if, like most seniors, you really would like to stay in your own home and age in place. Thank you.